This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
A question from Tessa Lee. She says, my friend has been diagnosed with APAS level 1 and 5. Would the condition affect her IVF success rate, and what precautions or medications should she take before or during treatment?
Sorry, I missed the first part of that.
The first part is, hi, Professor Chapman. My friend has been diagnosed with APAS level 1 and 5.
Oh, right. All right. Antiphospholipid syndrome. Okay. So this is an immune disorder which, in relation to pregnancy, has quite clearly been shown to increase the miscarriage rate. And just in spontaneous pregnancies with APS syndrome, it's quite clearly been shown that heparin or Plexane during pregnancy reduces the risk of miscarriage. So if you're going through an IVF cycle, they certainly would give you that. And they may also give you prednisolone as a steroid, which also modifies the immune response. So and it's important that you're looked after by a specialist who understands that and understands the significance of antiphospholipid syndrome. In terms of outcomes, in fact, it probably doesn't change the outcomes, provided that you're medically looked after properly.
Prof, when a cycle's failed, how do you decide whether to change protocol, change the lab, or simply try again?
A failed cycle is going to occur even now today when we have 40% success rates in women under 38. If one embryo transfers, 35 to 40%, it's pretty much standard these days. That means that every patient who comes through is likely to have a 60% chance of not being pregnant, and then therefore calling it a failed transfer. If you think about it, and that's not what you think about. What we know is that 35 to 40% is a recurring number. So provided you can keep having embryos, whether they be fresh or frozen, cumulatively things will happen. Now, if you're not getting good numbers of eggs and you're not getting good numbers of embryos from the number of eggs that you produce, then you certainly need someone to be looking at that cycle and seeing whether something different might improve the situation. And that's where I'm afraid many specialists claiming to be fertility specialists really just don't twig to that. And they haven't been trained in centres where they've seen so many cases and so many issues. And there's a tendency just to try it again and again and again on the same processes. But I think it is important to actually have things reviewed properly by someone who is skilled in the IVF arena. There's a qualification called Certification in Reproductive Endocrinology and Infertility, and there's about 90 of us around Australia who've been through what we call subspecialty training, way far beyond just being a simple gynecologist. Over half the cycles in Australia are actually done by simple gynecologists who are following recipes. And not every recipe fits a particular patient. So it is important, if things aren't going well, to seek a second opinion and potentially change clinics, change laboratories, and they may change the regime. So it's worth exploring further if you've had a failed cycle, but message I give again and again, don't give up just because you've had one failed cycle. If you're creating embryos, eventually there will be one that's good and you will get pregnant.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.